Welcome back to your channel name. Today we're going to explore Histrionic Personality Disorder, or HPD, a condition known for its excessive emotionality and attention-seeking behaviors. You might have heard of other personality disorders like borderline or narcissistic personality disorder. Well, HPD belongs to that same group, cluster B in the DSM-5. Let's dive into what HPD looks like, its causes, and how it's treated. Histrionic personality disorder is defined as a long-term pattern of dramatic, emotional, and attention-seeking behaviors that can significantly interfere with a person's relationships and daily functioning. The word histrionic actually comes from the Latin word histrio, which means actor, reflecting the theatrical and exaggerated behaviors often seen in individuals with HPD. People with this disorder crave being the center of attention and feel uncomfortable when they are not. They might act in provocative ways, but not always with sexual intent. It's all about drawing attention. This can lead to difficulty maintaining healthy relationships and can cause significant emotional distress. So what does HPD look like in everyday life? According to the DSM-5, someone must display 5 or more key symptoms to receive an HPD diagnosis. Let's break down these behaviors with some real-world examples. Discomfort when not the center of attention. Imagine someone in a group setting. As soon as the conversation moves away from them, they might start to feel uneasy and jump in with dramatic stories or exaggerated reactions just to reclaim attention. This need to be the center of focus is overwhelming and constant. Inappropriate, seductive, or provocative behavior. This isn't always about sexual behavior. It could be someone dressing in an attention-grabbing way or behaving flirtatiously in situations where it's out of place, like at work or in professional settings. Rapidly shifting and shallow emotions. One moment they're ecstatic, the next they're devastated. Their emotional expressions can be intense but tend to be shallow and change quickly, leaving others confused or feeling manipulated. Preoccupation with physical appearance. People with HPD often put excessive effort into their appearance, seeing it as their main tool for gaining attention. This can manifest as spending hours getting ready for even casual events or constantly seeking compliments on how they look. Dramatic or exaggerated emotional displays. Theatrical behavior is common. Individuals with HPD may use exaggerated gestures, voice inflections, or facial expressions. For example, they might act as if a minor issue is a catastrophe to draw sympathy or attention. Being easily influenced by others. Because people with HPD desire approval, they can be highly suggestible. They may change opinions, behaviors, or beliefs depending on who they're interacting with at the moment. Perceiving relationships as more intimate than they are, they often believe their relationships are much closer than they are. A coworker might simply say, "Hi," in passing, but the person with HPD may interpret this as a sign of a deeper bond. Now let's talk about what causes HPD. Like many mental health disorders, it's believed that HPD is caused by a combination of factors. Genetic factors. Studies suggest there may be a hereditary component to personality disorders, including HPD. If someone in your family has a personality disorder, you're at a higher risk of developing one yourself. Childhood experiences. Early life experiences like inconsistent parenting, neglect, or receiving attention only when behaving dramatically can lead to the development of HPD. These patterns get internalized and carried into adulthood. Cultural and social influences. Cultural norms that emphasize charisma, appearance, and emotional expression may also contribute. For instance, media portrayal of overly dramatic or attention-seeking behaviors can reinforce these tendencies. Diagnosing HPD is no simple task. It requires a thorough evaluation by a mental health professional, often including clinical interviews, observations, and psychological testing. For example, assessments like the Minnesota Multiphasic Personality Inventory, MMPI, can help pinpoint personality traits. Importantly, HPD often coexists with other disorders like borderline or narcissistic personality disorder, making it crucial for professionals to differentiate between them. Now let's get into treatment options for HPD. While no specific medication treats HPD directly, psychotherapy is the go-to solution. Therapy can help individuals with HPD develop healthier coping mechanisms and improve interpersonal skills. Here are a few common approaches. Cognitive behavioral therapy, or CBT, focuses on challenging the distorted thought patterns that fuel attention-seeking behaviors. For instance, someone with HPD might learn to question their belief that they must always be the center of attention to feel valued. Psychodynamic therapy looks at unconscious emotional conflicts that often stem from childhood. It helps individuals understand the deeper reasons for their need for approval and attention. Dialectical behavior therapy, or DBT, is excellent for managing intense emotions and interpersonal conflicts, skills that are particularly important for those with HPD. Group therapy offers a chance to practice social skills in a safe environment, but it must be managed carefully. People with HPD may dominate group discussions, seeking attention even in this setting. While no medications target HPD directly, treatments for co-occurring conditions like depression or anxiety can be helpful. For example, antidepressants or anxiolytics may be prescribed to manage these symptoms. In addition to therapy, lifestyle changes and a supportive environment can make a world of difference. Encouraging emotional regulation, mindfulness, and healthy social interactions can reduce the need for external validation. Mindfulness practices. Practicing mindfulness can help individuals with HPD become more aware of their emotional states and less dependent on others for validation. Building healthy relationships. Fostering genuine relationships, where the individual doesn't feel pressured to seek attention constantly, is key to long-term well-being. One of the biggest challenges in treating HPD is that individuals may not recognize the need for treatment. Because their behaviors are so deeply tied to seeking approval, they may resist therapy or downplay the severity of their symptoms. Additionally, they may struggle to form long-term therapeutic relationships, often expecting immediate attention or dramatic results, which can lead to frustration. In conclusion, histrionic personality disorder is a complex condition characterized by a persistent need for attention and exaggerated emotional displays. But with the right support through therapy, medications for related conditions, and lifestyle changes, people with HPD can build healthier relationships and lead more fulfilling lives. If you found this video insightful, don't forget to like, subscribe, and hit that bell icon for more in-depth mental health content. We'll see you next time.